Today on highlighting the MP, considering a career in medicine. If I had to go back in time, I would have probably pursued becoming a physician. So today on highlighting the MP, I have Dr. Reddhyia Taylor, who is a fourth-year medical student at Philadelphia College of Osteopathic Medicine, and she's going to be starting her family medicine residency this summer. Thank you so much, Dr. Taylor, for meeting with me today to just tell me about your medical school journey. I really appreciate it.
Thank you so much for having me. I just think it's a great topic. I'm happy to be here.
Yay, so let's get into it. So what made you decide to become a doctor?
So I, like many other pre-meds, have the story of a family member who ended up injuring themselves and they fell in love with medicine. So I kind of knew from a young age that I wanted to be a doctor, but I wasn't exactly sure what exactly that meant or how to even get there. So fast forward to undergrad and beyond, I really tried to kind of find experiences, clinical experiences that would show me what exactly a doctor was, just to make sure that it was for me. So I worked as a medical assistant at one point for a podiatry office. I did a lot of clinical experience in ortho and peds. I got to work with doctors in Ghana and just kind of figure out what a doctor does and what that meant. And through that, I kind of fell in love with kind of like the intersectionalities of culture and medicine, as well as improving the health of a patient. So I decided, yes, confirmed. I definitely do want to become a doctor. I want to be able to have autonomy with treatment and working with my patients and be able to kind of be like the final decision maker in that aspect. And yeah, so I ended up applying to medical school. But yeah, that's what really drove me, is that improvement for healthcare.
Amazing story. So you actually did the work. You had multiple shadowing experiences. You just to figure out like what doctors do on a daily basis and how they take care of people and patients. So,
Exactly. Yeah.
so
Yeah.
briefly describe your medical school experience.
So let's 4 years. So medical school is 4 years. So starting with first year was great. I came in, we all came in as like bubbly, bouncing, overeager medical students, just happy to be there. The workload was really hard, I will say. Not because of content, but really volume. So if you compare a semester of genetics that you would learn in undergrad, that would be 2 weeks in medical school. That's how quick everything happens. It's a lot to grasp. So I feel like when I finally started getting a grasp of it, first year, COVID happened and we went into complete lockdown. So the end of my first year and all of second year, we were unfortunately virtual, which meant courses, exams, like just assessments, labs,
Mhm.
were all online, which was a big struggle for me because I will give the disclaimer that I wasn't a person who goes to class. In medical school, you do have the option, depending on the school, you have the option to either go to class or watch the lectures, and I was a watcher, but virtual year, that second year, was still missing that aspect of like being able to go see tutors, go see your teacher. Certain labs that would be much easier in person had to be virtual, and just things like that. So that made it harder. Me personally, second year I had a death in the family. So we have COVID, we have a death in the family, and then it's the year you start studying for boards. It's not a fun year. But after boards, you get into third year where you get to do clinical rotation. So in medical school, you have 1 year to kind of figure out what specialty you want to be in. So we take family medicine, OBGYN, surgery, radiology, peds. We do a lot of them, but it has its pros and its cons because that's a short period of time to decide what you want to do with your life, you know? And if you didn't have a good experience on the rotation, then that you're probably not going to do that specialty, when really it wasn't the specialty. It might have just been someone who was there who didn't make it a good experience. So there's a lot of things like that. And then it's almost hard for, if you didn't have exposure to medicine pre-medical school, there's certain specialties that you wouldn't have known about unless you had like a family member in that field or something. So we do get exposed to the general core cookie cutter rotations, but like specific ones, like say you wanted to do ENT, like you definitely have to know that so you can advocate for that type thing, you know?
I see. So like they won't schedule you for a specialty that is not common unless the med student brought it up.
Unless the med student brought it up, or maybe it was offered at the hospital, but most likely no. Yeah. Mhm.
And then how was fourth year?
Yeah, so fourth year, up until September, fourth year was rough because you're just stressed. You're just trying to get a job. You're just trying to get a job. Most
Sure.
important part, yeah. So we had to do audition rotations. We had to submit applications, do interviews, the whole nine. Fourth year, but after you kind of submit your application, you're getting interviews, and after a match day, it's great. The stress is low.
I'm sure after you get that job, you're like, oh, I made it. All the
Like,
hard
thank goodness.
job.
Exactly.
Tell us what an audition rotation is.
Yes. So fourth year, you at the end of third year, you kind of decide on your specialty. Usually that's the latest you should be trying to figure it out because you want to go into fourth year with a plan. You have the option to apply to multiple specialties. You can apply to just one. It's really up to you, but you need to know what you're going into. And a audition rotation is essentially like a clinical rotation where you would go and work with residents and work with the doctor and kind of see what the specialty is. But this time it's at a residency program. So you have your first year residents or interns, you have your second year residents, third year and beyond. And then you, the medical student, are now a baby intern. You're a baby resident. You're doing all the things residents do. You get your own list of like a shorter list, but you get your own list of patients. And it's really like a month-long interview. So you have to be on your game for the entire month if you want to go to that program. So it can either make or break your application. If you go there and you don't do that great, you might not get an interview. If you go there and you excel, you'll be more inclined to get an interview with that residency program. So it's a nice way to show face, but if you're showing your face, you better be, on doing the right thing.
Yeah,
Yeah,
makes sense. Makes sense.
exactly.
What was the total cost of your medical school education?
Oh boy. So I actually looked up this year recently. So I'm fourth year. So this year I spent 100K. Tuition was 60, and then we got 30,000 for living and just life. So apartments, laptop, fees for application season and stuff like that. Then I actually had to take out more because the whole residency cycle was just way more expensive than I had. So I actually had to request for more. So which is why I went up to 100,000. Third year, I believe, is usually the cheapest because you're doing clinical rotations. And then first and second year was about, I would average out about 100K, maybe between 75 and 100K a year. So if you are deciding to go to medical school, it is about 300 to 500K. I'm paying for mine with loans. Thank the Lord. Thank you, government. I'm paying for it with student loans, but yeah, it's pricey.
Very expensive. So that's just med school in addition to maybe undergrad, grad. So that's a lot.
Exactly.
That's a lot of money. Thank you for your honor. Can a student get scholarships or grants to go to med school?
Yeah, so there are actually some medical schools, they actually give full rides. And I didn't realize that it was a thing until I saw people actually getting full rides. So medical schools, they do give full rides, but your application has to be popping. Like it has to be great. There are a lot of scholarships. I did get a few. I got scholarships every year, ranging between 3,000, like 10,000. The only con is 10,000 and 500, but it was very helpful. It helped pay for rent, so that's what we're thankful for. But with medical school, even when you graduate, they do have like public service loan forgiveness. Like if you work in underserved areas or you can get your loans forgiven after 10 years or significantly decrease. So there's like a few options to kind of help pay for it back. But yeah,
That's,
it's
no,
expensive.
that's good to know, though, just in
Yeah.
case wants to go to med school. If you don't want to, you spend 40 years paying loans, you could, work for an underserved population, and then your loans would be forgiven 10 years later.
Right, exactly. So that's a benefit.
Yeah. What are your pros and cons of attending med school?
So I would say the pros of med school, to be honest, just getting to live the dream. It's nice to know that once you've worked so hard to get into medical school, you've made it. Like it's almost what you've been dreaming about. You're here now. All you have to do is get through and finish. I do like the fact that medical school is a streamlined trajectory. Once you get in, if you get out, you have a job ideally. Most people do have a job after they get out, but it's kind of steps like take your boards, then do this, then do that, then apply to residency, then start work, then after residency. You don't necessarily have to do a lot of figuring it out on your own, which is what I like. The cons, the price. It's so expensive. And I say that medical school is just a profession of the rich. Even in medical school, there's so many things that you have to pay for that aren't really listed on your cost of attendance. Once you start your third year, you have to have a car. You absolutely have to have a car. You have to have a laptop. You have to pay for certain things out of pocket, and then sometimes you can get reimbursed, but it's a rich man's profession, so it is very expensive. Another con would be it's time consuming. A lot of people spend their 20s, or I
Sure.
guess their youth. We're dramatic, so you are youth in medical school, but it is a commitment. You miss events and stuff like that. So yeah, those would be the cons.
And what you said you get, were you saying you could get reimbursed for like certain like med school equipment?
You can get reimbursed for certain med school fees. So like fourth year, I ended up getting reimbursed for the money I spent for my applications. Granted, that reimbursement is more loans, but you can still get, like, you have to front the costs, if that makes sense,
So the school
before
doesn't reimburse you to
they reimburse you, but you have to have the money to even pay for it before the school reimburses you, because they like to see receipts. They want to see, okay, what did you you spend this money on? So yeah, it's just having that fund. But yeah, it's a great experience though. Like I've made a lot of, like, honestly, like, more family than friends, because we've been through the struggle together. So it's almost like a family relationship with them. So that's another pro.
Oh yeah, yeah. You definitely made a lot of friends and family, so
Yeah.
that's good. If you can name one thing, what would you change about medical school?
The cost.
Yeah, money.
Cost. Why? Why is this so expensive? Why? It's just so pricey. The cost. It's unfortunate that we'll leave medical school and have almost $500,000 in loans that we have to repay back. So that's like one con of medical school. Yeah, I think that would be my biggest one.
Okay. And what was the process like for you in applying for residency?
Yes. So, as I like hinted on before, so at the end of third year, you've decided on a specialty. You can apply to as many as you want. But once you start fourth year, you kind of have to gather the stuff for your application, which you will submit in September. So you need your letter of recommendation. You need, it'd be nice if you had a sub-I or an audition rotation under your belt to show that, show face to certain residency programs, your personal statement, and just like filling out your application and finishing boards. That's another one. So fourth year starts in June. So your main goal is getting boards out of the way, passing, doing well, and getting that done. But all the same time, you're gathering your letter of recommendations and stuff like that, and the other things you need. So for me, I decided I wanted to do family medicine at the end of third year. I didn't dual apply or anything like that. So, but I needed a family medicine letter of recommendation. So I found a doctor who allowed me to rotate with her for a month, and I kind of built that relationship and then asked her for a letter afterwards. Then I also did 2 audition rotations before submitting my applications, just to show face at residency programs. I did one in Philadelphia, kind of to show face in the area. And then I did one in Texas because I wanted to move to Texas. Like Texas was on my list of places to move to, and Texas loves Texas. So you have to like know, you have to have a game plan. So that was part of my game plan, and like showing face and getting to learn about the state and stuff like that before submitting applications. So your application opens I believe September. I can't believe it has been that long and I can't even remember the dates. But it opens, you can fill out all your application, but it's not released to schools till the end of the month. And it releases everyone's application all on the same day for programs to get. So yeah, and then you just play the waiting game. Some specialties send their interview invites on one specific day. My specialty, family medicine, it's a rolling. So maybe 2 hours after I submitted my application, I started getting interviews. So it really just depends. But yeah, that's fourth year. You do your interviews. There's like a magic number for different specialties. I think for family medicine, it was apply to 17 schools, interview at 12, and rank 10 of them. So at the end of your interview season, you'll put all the programs, program A, program B, program D, programs G, and you rank them all in the order you want to go to them. And on match day, you find out. So yeah, that's pretty much the process.
So each specialty program has like their special number, meaning like how many schools or programs you should apply to. Is that what?
Yeah. And it's not like scientifically proven. It's just like over the years, they notice like, okay, if you get these interviews, you're in a good spot to get a job type thing. So different specialties, it just depends. Certain specialties you need more interviews than others. But yeah, it's just trends that they've noticed over the years to kind of put you in that sweet spot to get a job.
I see.
Mm-hmm.
So describe your match week experience.
Yes, match week. It was such a great week. So normally match week works. You've submitted your rank list. You can submit up to 20 schools. You submit it about, is it? Oh, I think it's about like 2 weeks before match day you submit it. And yeah, you rank them all. So on that Monday, you find out if you got a job.
Mm-hmm.
And then on the Friday, you find out where you got a job. So on that Monday, you either get an email that you got a job or you get an email that you did not match. If you did not match, you enter something called the SOAP, which is this process where you are reapplying to all the vacant positions in the country. So it's really just what you want to do. If you'd rather reapply next year, you have that option. If you want a job, say you applied for emergency medicine, but you didn't match, then if there's an open spot in surgery, you can take that. If there's an open spot in internal medicine, you can take that. It just depends on what's open and what's available. So in those 3 short days, if you don't match on that Monday, you reapply to the programs that are vacant, you interview, and you find out if you have
job.
Yeah, if you've gotten a job, and then they'll give you your envelope and everything like the other people on that Friday. So Friday, everyone knows if they have a job or not. But yeah, it's a very taxing process if you do not match. And to be honest, why people don't match, it's just unfortunate because there aren't enough residency spots for the amount of medical students that there are in the country. And it's not fair because if you're taking me to your medical school, you should have enough spots, but there just isn't. So someone will not match. It has nothing to do with like their credentials or anything. It's really just the algorithm and the name of the game.
Yeah, I never knew about the program is called SOAP, if the unvacant residencies. That's what the process.
Yeah, that's what the process is called. I can't remember that. It's like supplementals offer acceptance program or application program, something like that. But yeah, it's an acronym for something, and that's the process they go through in order to secure a job.
Yeah, I never knew of that. I thought like if you didn't match, you just had to maybe get another job doing like maybe being a medical assistant doing research or wait till the following year. So I didn't know.
Yeah, that's an option as well. But doing soap doesn't guarantee you a job either, because you're interviewing again. So unfortunately, like there are people who you could not match, you could not soap, and now you have to enter those alternatives, either applying next year, finding a research year, doing something in the meantime till you can start residency.
Jeez, that sounds so stressful.
It was. But I will say that Friday, it was amazing. We all found out at 12 noon. We got an envelope and champagne glass because our school hosted a little event. We invited family, so we all opened it at the same time, and it was just so nice and just so overwhelming. I sobbed. I sobbed so much because it was just nice. It's just almost like a weight that's lifted off of your shoulder. So it was just. Yeah, it was a good feeling.
Yeah, congratulations. And then her announced like her opening that envelope was on the shade room. So
it was.
Yes, awesome. Black X.
I was so proud. I was like, oh my gosh.
Were you surprised when they tagged you?
Well, they actually emailed me first and asked.
Oh, okay.
Yeah, they asked permission. I didn't know they did that, but they did ask me permission first, and I was like, absolutely. And I called like my mom and my sister. I was like, oh my gosh, guess who emailed
me? Awesome.
Yeah, so it was nice.
What advice would you give to people interested in applying to med school?
I would say for people interested in applying to medical school, like one, don't give up. Like sometimes the process can be very annoying and very discouraging and things like that. But I would definitely say don't give up. A very important thing is to network and just build a network, because unfortunately that amount of money that people pay to apply to medical school, that does not guarantee that someone is going to read your application. It should, but it doesn't. So you need to be able to network and go to a school's open house or admission events, meet people, so you can say, oh, so and so, I actually submitted an application, can you look at it? Things like that, and create that network. That's very, very important when you're doing this process. And to be honest, anywhere, that whole networking, it doesn't guarantee you a spot once you pay the money. You really have to get someone in the office to look at your application. So networking is really important.
You got to do the work. You got to prove yourself.
Literally. Yeah.
Interesting.
Mm-hmm.
Last question is, in 5 years, what do you visualize for yourself in terms of your career as a doctor?
Hey, exciting. So in 5 years, I would have been done with residency, because family medicine residency is only 3 years. Thank the Lord. Thank the Lord. So I would be 2 years living that great attending life. Within family medicine, I'm really interested in integrative and lifestyle medicine. So really just kind of finding those aspects that contribute to health. So I really hope I have some sort of wellness clinic where I'm able to integrate integrative techniques, osteopathic manipulation, as well as those lifestyle techniques like, are you getting enough sleep? Let's have a dietitian come and talk to you. How's your mental health? Like all those aspects in one practice to kind of elevate your overall being. Like that's something that I'm really interested in. So I see myself having that sort of practice. I also want to do academia. I want to be a preceptor of some kind, being able to work with medical students when they come on rotations. And then I would love to do media in some aspect. I love social media. I love ways health can be integrated into social media. And I just want to be able to use those interests in some way. So maybe the news, I don't know, you guys, look out. But we'll see.
Oh my God, great 5-year plan. So a comprehensive wellness center that focuses on body, spirit,
Yes.
And then, so I guess I'll be seeing you on GMA, and GMA in a few years. We're looking at the next Dr. Jennifer type thing.
Literally, hopefully, prayers up. Yeah, but I would love to do that.
That's awesome. Awesome. Thank you so much, Dr. Taylor. I learned a lot today at school. I hope this was helpful to anyone who wants to pursue medicine. It sounds like, there are a few cons, but the pros definitely outweigh the cons. And if you have any questions, she has a page. Tell me your Instagram page again.
So my Instagram page is creative in a white coat. I kind of started that page because I just wanted to use my creativity and talk about medicine. And at the moment, it's a page where you can get like tips on medical school for pre-meds, for current medical students, as well as just life in medicine. It's very interesting to see. I follow a lot of people who have those type of pages, but it's just nice to see people going through it and seeing them make it on the other side. So yeah.
Thank you for sharing. Yes, thank you so much. It was great talking to you today.
Thank you. You too. Thank you for having me.
Thank you.